Data mining queries in SQL for predicting medical outcomes. This presentation provides information about SQL queries to predict probability of developing medical conditions such as diabetes. This presentation is prepared by Parvane Vaziri, MD, as part of HAP 709 Health Informatics program at George Mason University. Diabetes is a disease in which the body's ability to produce or respond to the hormone insulin is impaired, resulting in abnormal metabolism of carbohydrate and elevated level of glucose in the blood and urine. Diabetes affects an estimated 29.1 million people in the United States and is the seventh leading cause of death. Diagnosed diabetes increases the all-cause mortality rate 1.8 times compared to person without diagnosed diabetes. Diabetes increases the risk of heart failure by 1.8 times. Diabetes also is the leading cause of kidney failure, lower limb amputation, and adult onset blindness. In addition to these human costs, the estimated total financial cost of diabetes in the United States in 2012 was $2.45 billion, which includes the cost of medical care, disability, and premature death. In 2015, 30.3 million Americans, or 9.4% of population, had diabetes. Approximately 1.25 million American children and adults have type 1 diabetes. Of the 30.3 million adults with diabetes, 23.1 million were diagnosed and 7.2 million were undiagnosed. A study showed that diabetes case finding algorithm using data exclusively extracted from a comprehensive electronic health record can accurately identify patients with diabetes at the earliest possible date within the healthcare system. The data used in this presentation is simulated data from major healthcare institution electronic health record in the United States. For the purpose of this presentation, I have used Agency for Health Care Quality and Research Clinical Classification Software, CCS codes, to define diabetes and bacterial infection as risk factor for diabetes. These CCS diagnosis codes corresponds to the format of ICD-9 codes in the data. A comprehensive set of diagnoses were used to predict the presence of diabetes or the risk for diabetes. This is a total number of diagnoses for which I had at least 29 observations. The age greater than 40 was added to these predictors by using where command. This is an example of obvious predictors. These are medical conditions that always occur with diabetes or have the word diabetes in their name but were not used as a definition of diabetes. Examples of 10 rare diseases that are predictive. These are diagnoses that occur more than 29 times but less than other diagnoses. These are examples of 10 most predictive diagnoses that are not obvious. For data mining purposes, naive Bayes theorem was used to aggregate data from any individual diagnosis for overall risk for diabetes. These are identification of case with 5 diagnoses. These are queries for calculating corresponding likelihood ratio and calculating odds of diabetes. For cross-validation purposes, 80% of the data was set aside to be used for training, and the remaining 20% will be used for validation of the models. Predictors that occur after diabetes were ignored. A receiver operating curve used for the cross validation accuracy of the predictions. This curve is a plot of a true positive rate against the false positive rate for the different possible outpoints of the diagnostic test. It shows the trade off between sensitivity and specificity. This presentation concludes that data mining can be an effective approach to harness the information from massive data in healthcare. Calculating likelihood ratios, determining specificity and sensitivity, and the receiver operating curve are queries to predict the health outcomes. The statistical analysis used in this presentation provides insight about outcomes and prognosis of diseases for the healthcare providers. Thank you for listening.